Welcome to Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. We're going to take you through the entire CBCT and show you areas of where we can see problems with the teeth. Let's start with the lower left quadrant where the area of interest the doctor has highlighted to us. The lower left quadrant, the lower left first premolar. Let's start with that. As you can see, we've got a restoration here. As we're moving distally, there is secondary caries developing underneath the restoration right at this point. So that is something that is cause of concern. Moving to this tooth, this is a tooth which has crown cutting done and an endodontic treatment. But under the endodontic treatment, we can see that there is a periapical radiolucency because of a short obturation in the endodontic procedure that's been done. So because of this short obturation right here, we've got a periapical radiolucency in the lower left second premolar. Moving to the lower left first molar, we can see a major radiolucency. Along with that, we can see that this radiolucency is associated with some form of a cracked tooth syndrome, as this patient has had similar complaints according to the doctor. We can also see that the radiolucency extends in the interradicular region, and as we move towards the distal root, we can see that there is a radiolucency which resembles a J-shaped radiolucency in the lower left first molar. And here you can very clearly visualize the crack that is right here. And this is one cause of concern. Moving to the lower left second molar, this tooth also has a very large restoration which is suffering from secondary caries, which we can see here and here, and we can also see some leakage right here. So you can all very clearly visualize that this tooth also has some leakage under the restoration. We don't see any major periapical radiolucencies associated with the lower left second molar. Moving to the upper left segment, you can see that the first molar has endodontic treatment done. This is the distrobuccal root, mesiobuccal root, my apologies. And the mesiobuccal root, we can see we have a radiolucency developing here, which shows endodontic failure. This is the parietal canal, which doesn't have radiolucency. My apologies. And then moving to the distrobuccal root, we can also see that the distrobuccal root has PDL widening, which we can see precisely here. Now moving to the upper left second molar, we've got a amalgam restoration because of its radiopacity. But underneath the restoration, we can see that there is secondary caries right here as well, and that is something to be kept in mind. Now we're going to move to the upper right segment. The upper right segment has a crown restoration on the second premolar right there. We also have some endodontic extrusion that we can see at the apex right here. There we go. So we've got an overextended GP, and that is leading to PDL widening that we can see right here. And then along with that, we can also see that there is some cedar material which is extruded and embedded into the buccal cortical plate next to the upper right second premolar. Now moving to the first molar, we can see again poor obturation in the mesiobuccal root along with PDL widening. You can also see sinusitis here in the maxillary sinus. And then moving to the parietal root, we can also see that there are radiolucencies interradicularly, and we have a radiolucency in the upper right first molar distrobuccal root, and we believe that the distrobuccal root is fractured because of this significant radiolucency we see right here. And then moving to the upper right second molar, we can see that we've got radiolucency developing in the parietal root right here, and because of this we can assume that this sinusitis is maxillary sinusitis, odontogenic sinusitis, because of this particular second molar having its radiolucency so close to the maxillary sinus. So this is what we see in the upper right quadrant. We can also see this radiolucency which is perforating the buccal cortical plate. So distrobuccal root has a periapical radiolucency which is leading to perforations in the buccal cortical plate. So this maxillary sinusitis is definitely odontogenic in its nature. Moving to the lower right segment, we can see that we've got a endodontic treatment done in the lower right second premolar, and that is also leading to a significant periapical radiolucency in the lower right second premolar, and we can also see poor obturation and a per, close to perforation or strip perforation in the obturation as well. If you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.